This East End Toronto neighbourhood is a bit of a doctor desert. A spike in family physicians choosing to retire left hundreds of people searching for a family doctor. Many came here, to the Malvern Medical Clinic, and one of the few family physicians accepting new patients, Dr. Joseph Parham.
Identify more with the patients as well.
He began practicing just before the pandemic hit and was quickly inundated with patients. He still is. See this stack of envelopes?
It's basically families, groups of patients who are looking for family doctors.
This represents around 100 would-be patients, and that's just from the past week.
We try to whittle this list down, but it just keeps getting longer and longer and longer. Madonna?
Yes.
Want to come on up? All right. Good morning.
Hi, good morning, Dr. Parham. How are you today?
Not too bad. How are you?
I'm great, thank you.
All right.
Thank you for seeing me so proudly.
Madonna Lane managed to get on Dr. Parham's roster after her previous family doctor retired.
When your doctor's retiring and, you phone around, it's difficult to get anyone to take you on.
All right. Why don't I get you onto the examination table?
There's been a surge in family doctors around Ontario leaving their practices.
Deep breath in and out.
It's part baby boomers retiring and part pandemic burnout.
In general, what we've seen is a lot of physicians, older physicians, and some younger physicians suddenly go out of practice for various reasons.
So, how about replacing those retiring doctors with newly trained doctors?
In the past couple of years, that's completely dried up.
Across Canada, the proportion of med school grads choosing family practice is dwindling.
So we have no new residents who are interested in coming. We've had advertisements and sort of used all of our different tools that we use to try and recruit new doctors, and have found it really, really difficult and basically impossible at this point.
This makes it even harder to find a family doctor now. Just listen to how far some patients travel to get here.
We're talking 1 to 2 hour drives, as far west as Hamilton, as far east as Bowmanville. Some people are driving here for those appointments. Some people are actually taking public transit.
What's one structural barrier?
Here at the Black Health Fair and Wellness Summit, the goal is to improve access to healthcare for people in the Black community. We met Kimberly Thompson here. She hasn't had a family doctor since 2019.
It was definitely challenging because I had to go to walk-in clinics, and even though the family doctors that I did see there were very helpful, I wasn't able to see one consistent family doctor. So I was constantly having to retell my story, retell my family, my medical history.
What makes her situation notable? She's a doctor herself.
I went away to study medicine abroad, and when I came back, I finished my medical degree. I realized when I came back home that my family doctor had retired. And ever since then, for the last few years, I've been trying to find a family doctor.
Miranda Savoie hasn't had a family doctor since she turned 18. That's more than 10 years ago.
I used walk-in clinics a lot, the emergency department a few times.
When she was a university student, she suffered sharp back pains. A clinic doctor suggested breast reductions.
And I actually found out a year later it was gallstones. I had to have emergency surgery. I had to be in the hospital for a whole week. That's something I probably could have avoided if I had that long-term doctor.
Dr. Rose Zacharias leads the Ontario Medical Association.
We need more trainee spots, but we also need to combat against burnout.
So I'm just going to wrap this around your arm.
One solution being floated to all this, other health professionals taking some of the workload off family physicians.
Great blood pressure.
Nurse practitioners can do just about everything a family doctor can.
This just shows me your oxygen levels and your heart rate.
They can diagnose, prescribe, even send you to a specialist. At this clinic in the northwest corner of Toronto, nurse practitioners lead a team of healthcare professionals caring for hundreds of patients.
We have a dietitian, we have an RN, we have a social worker. And the idea, of course, with team-based care is to be able to wrap around services for individuals that are in need.
So, Mike, I'm hoping you have tips for people who are struggling to find family doctors.
So first of all, don't just call around to a bunch of family doctors' offices trying to find a spot. All the provinces have a program to match people to family doctors who are accepting new patients, so make sure you get on those lists. Also, try to be open to alternatives, like that clinic that we just saw led by nurse practitioners.
And what about what's happening next week? We know the Prime Minister is meeting with premiers. presumably the shortage of family doctors is really high on that agenda.
Yeah, absolutely. So the federal government wants to attach strings to any extra funding, and here is one of those strings. Ottawa wants the provinces to get more people enrolled in what they call family health teams. So that means family doctors working together with other health professionals, maybe mental health workers or nurses. So look for that to come up.
All right, Mike Crawley, thank you.
You're welcome.